Today we're here with Howie Groff, Executive Vice President of LifeSpark. Howie, how did you get started in this profession? Were there any specific people or events that led you to choose this?
It's a long story, but what got me involved in the healthcare profession initially was I served as an accountant for a large clinic in the Minneapolis area. And from there it led to a series of jobs. In one of them, I ended up being the vice president of finance for a small chain of nursing homes, all based in Minnesota at the time. That company was eventually acquired by Beverly Enterprises, and I was fortunate enough to work my way up there, which led it to our starting our own organization some 32 years ago. And if you'd have asked me years ago, would I be here? Probably not. But the other side is I've loved every minute of it. It's been very rewarding. Obviously, getting the chance to help folks that need services was very rewarding over the years.
Absolutely. Now, your company was recently part of an acquisition. Do you think the sector is experiencing more acquisitions, and why was this a good choice for your company?
I definitely think you're going to see a lot of activity. When you look at the data that's out there, the returns that we're seeing in assisted living predominantly are much better than any other real estate investment. So it's going to attract those kind of folks. And so I think we'll see some of that. I think consolidation right now is not a bad thing, because to do things on your own, being a small organization, is very difficult without having people that can be very successful with navigating right now. It's very difficult. Has it been good for us? Yes. And I would tell you the reason I think it's going to be good for us is it takes us to a new level. We're working with an organization now by the name of LifeSpark, and I'm a small part of that at this point. What I'm excited about there is they've actually gone at risk with Medicare Advantage. And I think that's something we need to look at very, very seriously in our sector.
As a longtime professional in the skilled nursing facility and assisted living sector, what makes you excited about the sector as a whole moving forward?
Well, obviously, you got to look at the demographics. You can't look beyond that, but I'm now getting there. I'm a boomer, so I've got a personal interest coming up probably. But on the other hand, I think with technology, we have some really, really interesting opportunities for us. So at LifeSpark, instead of calling it a medical record, it's called a life record. So if you think about what if we were able to work with people at early 60s, mid 60s, and then look at what are those traits they have and look at their life, not just focus on maladies. We use a phrase in LifeSpark, it's called sick care. Our system is set up for sick care. When do we go to the hospital? When we have a major malady or we break something. When do we go into a skilled nursing center? When we have had some sort of an event in our life. Same thing with assisted living. Well, what if we could look at that more from a perspective and use artificial intelligence to go, okay, Howie, here's your issues. Overlay that on people who have been through that before and go, here's what you're looking at if you don't change this habit. Or we can help you here by doing some wellness programming and things like that. So that's where I think the excitement comes for me.
Yeah, sounds really forward thinking. In what ways can assisted living centers get more involved in sharing important information and narratives around assisted living?
What we've never done, I think, in the entire long-term care sector is really tell our story. There are so many wonderful stories about success out there that we'll go home and maybe talk to our spouse about it, or we'll talk to our family about it, or some friends, but never makes it into the paper. As you listen to the sessions that are going on here, and you ask the people what's rewarding about this, they've all got a story. Absolutely. I helped Mrs. Smith. I helped this person was a former doctor, and we were able to get him back to this. And so I think it's all the good things we do that can add up to having a story to tell. So when we look at the data, what we need to capture are data both for personal and also for medical. And then look at what are we doing and what are those successes? What can we do better? What can we do to improve longevity? If you look at what Medicare produces, and this is Medicare data, and I'm going to be close, I'm not perfectly accurate with it, but 5% of the people drive 40% of the spend. Think about that. So there's a lot of room out there to do some really good things. That's why if we can tell our story and then get ourselves up the food chain where we have more access to revenue and go at risk. I think going at risk is going to be required for us to be successful in the long run in the future.
How can long-term care providers be more involved with wellness programs, kind of what you mentioned before, preventative care, instead of it as a last resort?
So we looked at the 7 dimensions of wellness. It's out on the internet, probably about 15 years ago. And what we looked at are the components of it. And when you think of wellness, you think, well, you got to get to the gym and work out. Well, it's much more than that. You need to do things mentally to challenge yourself. You need to do things spiritually, socially, et cetera, nutritionally. And I always joke now, my parents had a garden when I was a kid. We never call it a healing garden, but we do in the wellness program. And if you think about it, you're out there dealing with it on all times, and it's bringing life right in front of you. Well, why not replicate that in other fashions?
Absolutely, especially coming out of the pandemic when we really learned that people's mental health, social connections, and all of these other areas were so vital to focus on.
Yeah, and it's the whole body you're dealing with, not just am I going to get stronger, am I going to do this? And I think the other thing with wellness is it's going to drive where you're capable of living. So let's just use this for an example. If I live in a 2-story house and my bedroom's on the 2nd floor and I can't walk up the flight of stairs, probably not a good setting for me to be living in. So can I go through a program that allows me to figure out how to walk up those 2 flights of stairs? We'll see. But those I think that's just a minor opportunity that we would have in the future.
It's interesting to take it to that next step instead of just quantifying and seeing what's happening, to make the predictions and the suggestions based upon that. Very interesting. It's exciting things.
Yes.
Well, thank you for being with us today and
pleasure.
talking about assisted living. I appreciate it.
Thank you very much for the opportunity.